Hi, I'm Dr. Harry Mittelman, Director of the Mittelman Plastic Surgery Center, and I want to give you part 2 of a discussion on facelift surgery, discussing the SMAS face neck lift and the deep plane face neck lift. So I talked to you about this recently and talked to you about the SMAS facelift being under local anesthesia, and by doing it under local, you avoid the potential complications of general anesthesia and the benefits of doing it that way, as well as the fact that the deep plane facelift can be done and be very effective. Today I'm going to talk to you about some other differences, and I think those are going to be of great interest. When we do the SMAS face neck lift, we have 4 different categories of lifts. We do what we call the Mittelman Mighty Mini Tuck, a mini face neck lift, a young woman's face neck lift, and the classic standard face neck lift. Now, the classic standard face neck lift compares well with the deep plane facelift, which is also a full facelift that involves the upper part of the face, the lower part of the face, as well as the mid face. And that's the same thing that occurs when we do a classic standard SMAS face neck lift. However, not everybody wants to do a full classic face neck lift. There are people, particularly those people that are very young and that are just beginning to get aging in the jawline and maybe a little bit in the neck, and their upper face is still quite tight and looks great. And those people don't necessarily need a full classic face neck lift. With the deep plane face neck lift, almost all the surgeons I know do only that full face lift, which is the classic face neck lift. But they don't have the ability to do a Mittelman Mighty Mini Tuck or the ability to do a mini lift or a young woman's face neck lift. And some people only need that. And especially that's true for the people who are just beginning to age and the older people that, let's say, are over 65 or 70, and they just want to have a little bit of an improvement in the jawline and the upper part of the neck. And they're not interested in having other portions done, and they want a short, quick recovery time with no pain, as opposed to something that involves a longer time out of work or away from work or not being able to get back to their normal activities in a very short period of time. And by that I mean 1 week to 10 days, 1 week to 2 weeks. So that is a big benefit of that. Now, another benefit of having a SMAS lift and the variety of what you can do with it is that we can do a mini lift or a Mittelman Mighty Mini Tuck on a patient who is diabetic, for example, but under control. We can do it on a smoker. Even though we do have them stop smoking maybe a week or so before the procedure and a week or so after the procedure. But those are some of the variabilities that can occur with that situation. So I think that's something that's important to understand. So not everybody has the same goals. And so if you want to have it done under local anesthesia, the SMAS lift is more commonly done that way, and that's what we do almost all the time. If you want just a mini lift or a Mighty Mini Tuck, that can't be done with a full face neck lift that's done under deep plane facelift techniques. So all of those things need to be considered. So I think the patient needs to be given all those options. And when you have all those options, then you can make a decision as to what you want to do, but not a one kind of facelift fits every person that wants to do a facelift. Thank you.